Hi, so why are you here today?
Well, I have a problem that concerns me. I have large labia, and when I exercise and ride a bike, it's really a problem and it bothers me. So I was seeing if there's anything I can do about it.
So let's talk today about labia in general, in particular, as it pertains to your case. It's very important to first distinguish between a functional problem and an aesthetic problem. So if there's a functional problem, such as difficulty with retaining urine, and there's stress incontinence, or if there's pain on intercourse, those have to be diagnosed and investigated further. And we often do that with a gynecologist that we're associated with. However, if we're going to discuss the aesthetic part of a labiaplasty, we do not need to investigate those issues, and we can just discuss the ways we can reduce the size. So to best describe that procedure is to imagine that the shape of the labia is the same as the wings of a butterfly. And if you are going to reduce the labia, you want to maintain the shape, but you want it to be smaller. You want to make sure that sensation remains intact, as does the blood supply. So there are methods out there that you may have read about or hear about, where some people reduce the size by removing a wedge, and some reduce it by using a laser to do the surgery. I, in particular, like to do it the old-fashioned way, where it is traditional and has been proven to work and provide satisfaction to the patients that we have. And the way I like to do that is by doing the conventionally reducing the labia in its periphery. So just like in the wings of a butterfly, the blood supply is mainly at the bottom of the labia. And so by reducing the labia in the periphery, it doesn't disturb the blood supply or the sensation. So the procedure is done, could be done under numbing medicine or under anesthesia where you're asleep. And during that procedure, the periphery of the labia is reduced. That's also reducing some of the extra pigment that some people don't like. And the suturing that's done is done by self-dissolving sutures, so they do not need to be removed. The patient usually, or you'll be able to leave the office by yourself, or best, however, with an escort. And you probably would need to stay home for about a day or so to apply ice and be on bed rest. One can go back to work if it's a regular job without lifting heavy things within a week or two. However, as far as rigorous exercise or sexual intercourse, one should wait about 6 weeks. And the procedure is really benign and is met with a lot of satisfaction from our clients.